So what is a seizure? It's something that we're probably all familiar with and we've all witnessed it, but what is it? So these are sudden bursts of electrical activity in the brain that temporarily affect the brain. So we know what a seizure is, but what is the cause of a seizure? So there are a few reasons. Firstly, is it because our patient is withdrawing from drugs, withdrawing from alcohol? This is common, and it's caused by a physiological response when a patient suddenly stops using a substance which the body has become dependent on. Have they had a traumatic brain injury? This is rare, however, it can be a result of a brain injury. This will most likely happen following the first few days following the injury. And then finally, is your patient epileptic? So first, let's look at epilepsy, one of the most common causes of a seizure. So when diagnosing epilepsy, the following terminology may be used. The word idiopathic, which means there is no apparent cause. The patient has had a CT scan, they've had tests done, but there is no apparent cause for the seizure. There's cryptogenic, where there is likely cause for the seizure, but currently unknown. And then finally, we have a symptomatic seizure, and a cause has been identified. So there's two types of seizures that an epileptic can experience, a partial seizure or a generalized seizure. So we can see by the pictures below, a partial seizure involves epileptic activity in only part of the brain, whereas the generalized seizure involves epileptic activity in all or most of the brain. And within the partial seizure, there are two further seizures which can occur. There is the simple partial seizure, and the person will be fully conscious. However, they will have no control over the sensations which may occur. And this can be jerking, limb movements, tingling, and even an altered taste or smell. Patients quite commonly become pale and clammy, and this can also be quite disturbing for the patient as they are fully conscious. And then we have a complex partial seizure, where the person remains partially conscious. They may collapse, they may not collapse, but they will not recall the event of the seizure. Continuous swallowing and chewing are common signs, and their behaviour may be out of character. Commonly, this can lead to a tonic-clonic seizure, and this is known as a secondary generalized seizure. So a tonic-clonic seizure, we're probably all quite familiar with this seizure. The patient will have a loss of consciousness. They will present with stiffness and jerking limbs. This happens because the body's muscles contract. No attempt should ever be made to restrict the patient's limbs, only protect them. The patient may have some urinary incontinence, and tongue biting is quite common. Never force anything into your patient's mouth. There may be some reduced air entry into the lungs, and the patient will become cyanosed. High flow oxygen is essential at this point. Quite commonly, people will have absence seizures. These happen quite frequently and may look like a patient is just staring and perhaps daydreaming. Within that time period, they are unconscious. However, these are uncommon in adults and most likely will be seen in paediatric patients. Myoclonic seizures. These result in a sudden contraction of muscles, which usually affects both arms and sometimes our patients' heads. They are very brief moments. However, within that time period, the patient is unconscious. So we've discussed tonic seizures, and then we have atonic seizures. So instead of the muscles contracting, patients will have a sudden loss of muscle tone, and this results in a sudden collapse. The patient will fall to the floor and then regain consciousness. Therefore, there will be a quick recovery. However, there is a risk of head injuries. Quite often you will see, especially young people, wearing helmets, and this is because they would usually have atonic seizures. So how do we manage a patient who's having a seizure within urgent care? Firstly, we're going to call for help. We cannot manage this situation alone. We need to check our patient is breathing, and we're going to roll our patient onto their side to avoid aspiration. We will then administer high flow oxygen, that's 15 litres via a non-rebreathe mask. We're going to take a full set of observations and document them, and we need to ensure the patient has a patent cannula in case we need to give any IV medications, and we're going to then bleep the doctor. So following a seizure, how can we expect our patients to recover? Well, initially they may be tired, they may appear confused and experience some dizziness and complain of a headache. These symptoms on some occasions can last a number of weeks. However, the initial period following the seizure is called the postictal phase, and it's not common for people's GCS to be slightly reduced at this stage. Regular neuro observations and routine observations should be carried out. So thank you for watching this presentation. If for any reason you have any further questions, then you can contact me on email. Always remember to shout for help and keep your patients safe.